So we were talking about the legislative session. We talked about the first thing they did was pass a borrowing bill where they borrowed almost over $1 billion. Governor Pawlenty cut it back, not enough in my opinion. Then they came out and they extended the GAMC for another couple months. Our third form of health handouts for the poor in Minnesota. Let's talk a little bit about health care. That's been the talk at the federal level now.
Healthcare, fortunately, I know a lot about healthcare. My 8-year-old was diagnosed with leukemia last June. And this happened 4 months after we canceled our insurance policy so that we could get on a better plan, something that wasn't costing $1,300 for a family of 5 at the time to be on. It was $1,300 a month. And the best part that I've heard is, well, we have places that you can shop healthcare in Minnesota. No, we have 3 companies.
Right.
And all 3 of their bids are within $10 of each other. You don't have 200 and some options, you have 3 options. And they're all the same, but they're nonprofit. So, you know, it's all good because they're nonprofit. But we canceled our insurance 4 months before she was diagnosed with plans on starting it up in 5 months. Back again. We figured we could pay for it out of pocket for 4 months. I have an idea for insurance, and it goes against my libertarian friends and even some of my conservative friends, but I think we have 50 states. Why aren't they all coming up with different ideas? And we go, hey, this is a good idea. Let's pull from this one. Let's pull from that one. Instead, we had a blanket policy thrown over the top of us that we're all supposed to abide by. Minnesota right now covers everybody. If you need health coverage, you're covered in Minnesota. We have MinCare, we have Medicaid, we have plans galore. If you don't make enough money, you're fully covered. MinCare basically looks at your income and says, okay, here's what you can afford to cover. We'll flip the rest of the bill. These are things that I'm not against these things because healthcare is hard to afford if you don't have a job that provides it. I can't provide it at my workplace, but I don't have full-time employees all year, so that makes it a little easier. But $1,300 a month, you're talking 16 grand a year for a family of 5 for coverage. That's a lot of money. Your average family makes 50 grand a year before taxes. Let's say they're down to 40 grand a year after taxes. All of a sudden, you know, you got almost half your income goes right into health care. And the problem is you don't fix it by paying for insurance. That doesn't fix it. That's like putting a Band-Aid over your head after someone hits you with a baseball bat. That doesn't fix the problem that you got hit by a baseball bat. The costs are crazy because you have, I call it CYB. CYB medicine is what's practiced in Minnesota. It's cover your butt. The doctors.
I was going to say, I don't know the B, but the.
We're on TV.
I know.
But I talked with the doctors, I talked with the nurses, and they all told me the same thing. They have to run a multitude of tests because if they don't, they can get in trouble and get sued. 40 to 50% of the tests they're running, they don't have to run. They don't even think they should be running it. But if they don't run it, they're going to get sued. So you got half of your tests are unnecessary in the doctor's eyes. And I think the doctors know what they're talking about, most of them at least, seem to have a good grip. You need to get rid of that kind of mentality that's going on in medicine right now. That's half of your test costs right there. The bottom echelon of money that you're paying out. Your preventive care, I get stitches, little things like that where you go in. That stuff needs to start coming out of people's pockets instead of on full coverage because that's something you can shop for. That's something you can look around, you can find the best deal. I need to get a strep test. There's a clinic right up the road that for $40 will test me for strep and within 5 minutes let me know if I've got it. These are things that I don't need insurance. I don't need an emergency room. I don't need any of that to get done. But my daughter gets diagnosed with cancer. I don't have time to shop around for the best hospital for treatment. I don't have time for that. These are things that need to be taken care of with insurance. So I think we need to start moving more towards, instead of this blanket coverage for everything, let people be responsible for that bottom chunk. That's, you know, not the big expenditures, the little things, the checkups and whatnot. Let people pay for those. Let people get insurance policies for those, health savings accounts for those. This top, you know, the big chunk up on top, the emergency catastrophic care, that's where we got to start looking at. That's where coverage comes in. That's where people need coverage and we need protection for everyone in that because it can destroy you if something like that happens financially.
Exactly right. You talked about, just to give the short version of what you just said,
Right.
Tort reform,
Tax reform,
insurance reform, and buying across state lines.
Exactly.
It's so simple.
It's not that tough. When you figure it out and you lay it out, it's actually pretty easy.
Right.
I mean, yeah, if we were allowed to buy medical insurance the way we're allowed to buy auto insurance, how come I could drive a car and have a $4 million policy on my car against me taking out an entire family in a minivan, and I can pay $200 a month for that? But I can't get medical insurance for the same amount same amount of coverage, of medical coverage, for the same dollar amount. It's because there's no competition in it. You got 3 companies all within $10 of each other on every bid.
Yeah, people don't understand how heavily regulated the insurance industry in the state of Minnesota is, and more regulation that we just saw at a federal level and soon at a state level is not going to change that.
Oh, it's ridiculous. And then they force you to cover things. They force the insurance companies to cover things.
Yeah, you get to be covered for pregnancy.
Exactly. I'm covered for pregnancy. I'm not getting pregnant anytime soon. I've got 4 kids. I'm not planning on having any more kids. I'm covered against drug and alcohol abuse. I have a couple of bottles of wine a week. Okay, I don't need coverage for that. I don't need chiropractic coverage. I'll pay for that out of pocket. I don't need all these little nitpicky things that are being thrown in and forced to be covered. Why can't I get a checklist from an insurance company and say, these are the things I want to be covered for? Now tell me how much that costs, and then send it off to 50 companies and let them bid for me.
The other thing that I think conservatives forget to bring out frequently when talking about health care and how we could fix some of it is to attach the tax deduction to the individual.
Right.
Because if you take that away from your employer, I used to tell people, because I owned a small business and most of them were part-time employees, and I would say, go tell your boss, your full-time boss, because I was the part-time boss, that you don't want insurance. You'll take the money. You'll take the pay increase, and then you'll go out and buy your own insurance, and you can buy catastrophic something else. Instead of being forced to buy whatever your company determines, I'll take the money every day.
Exactly, yeah. I just got a bid, literally, about half an hour ago. I was talking to my insurance agent. I can get $5 million lifetime coverage on my entire family, but I'm responsible for the first $7,000 a year. But I also get $300 worth of preventative care on each person in my family. It costs me $400 a month to get that. That's affordable. People can afford that. $400 a month, cut out the cable bill if you have to. What's more important, your health or, watching American Idol?
Right.
And that's the direction we have to head with this, is because you want blanket coverage for everything. Auto insurance doesn't pay for everything, and neither should health insurance. You should have to be responsible for some of those things. It doesn't pay for LASIK surgery, but people want it to, and I don't need to pay for a strep test. I can go pay $40 for a strep test. I can pay to get my hand stitched up. I can pay for these little things. Just cover me in case of an emergency. Something bad happens. Exactly.
Like insurance is supposed to work.
Like insurance is supposed to work.
Okay.